It's informative. It's healthy. And it's the news. Welcome to the Health Connection. This week's special episode, the State of HIV.
Hello, everyone. Good afternoon. My name is Kishi Martin. I'm a health promotion peer navigator for Care Resource, and I'm also your host for the Health Connection. Today's episode is very important. We are observing World AIDS Day 2020. This day is special because it has been observed since 1988, and not only does it let us remember the lives of those that we have lost to HIV and AIDS, but it's also a day to move forward in our efforts to ending the epidemic. This year is no different, and two special guests that I have with me on this episode are both contributing to ending this epidemic. And first, we have Dr. Robert Goubeaux. Please tell us who you are and what your specialty is.
Sure. Good morning, everyone. I'm so glad to be here. I'm Dr. Robert Goubeaux. I'm one of the medical directors here at Care Resource. I'm the director for the Miami Beach and the Midtown offices. I'm a family practice physician here, and I've been with Care Resource for about 5 years and have witnessed everything from the beginning up till now, and I'm glad to be here.
Thank you so much, Dr. Robert Goubeaux. I'm glad you're here too. All right, and my next guest is Jairo Farinas. Please let the people know who you are and what you are doing to end the epidemic.
Hey everybody, my name is Jairo Farinas. So I am a HIV tester and supervisor here at Care Resource for a health promotion department. And yeah, basically what I do is do testing to make sure that everybody knows their status and stays safe.
All right, thank you. I'm glad you all are here. So now we can get into the first question, which is, what is World AIDS Day? What is World AIDS Day? We do know that this is a day that has been observed since 1988, but what is the history and what efforts have been done that either one of you can share, either in your own experience or things that you feel the audience should know?
Sure, I can start with that. Since I'm probably the oldest one here on this little committee here. So, I mean, I can remember back in the 80s, at the beginning of all of this, I can remember when I first heard of HIV. I was actually in my first year of college, and it came up on the news in the student union. And everyone was freaking out and wondering what, was going on. At that time, everything was, no one knew much about it at that time. It was the gay disease. And I can remember back even in medical school in Des Moines, starting ACT UP. And that was a group that started back in, I believe it's in the 80s, maybe a little bit before. That was really coming out and protesting against the government, really, of us not getting any response, not getting any action to help treat or take care of those patients or those people with HIV. And as some of you know, I probably don't, newspapers, the old days. We used to we had these little stickers that had the government has blood on their hands. And we had gone out on a Sunday morning to all of the newspaper stands where people used to go to pick up their newspapers, and had stuck these stickers all over the newspapers that they were getting. So the people were waking up to these Sunday morning newspapers with, wow, this information right in front of their face, so they couldn't kind of hide from it. And then as things have gone, we've seen the progress, we've seen things get better. I was also involved with the South Beach AIDS Project, which also helped with kind of steering people with how to use protection, making sure you're practicing safer sex. Back in those days on the beach, things were kind of wild and crazy. So it was a way of us we did poster campaigns on recreational drug use and the increase in possibly obtaining HIV and other STDs, STIs now we call. So it's been a long road, but we're seeing I think we're starting to see the light at the end of the tunnel with this.
I agree. That was a lot of very important and significant information. I appreciate you for sharing that. And that same question now applies to you, Jairo. Is there anything in particular that you'd like to share regarding World AIDS Day, or even things that you have done or witnessed since being in this field?
Yeah, no. So my experience is definitely different because I was born the day that that World AIDS Day began, which is in '88 actually. So my experience is definitely a lot different. So really, and this may resonate with some people, where you kind of don't know significance of it until much later, when let's say something personal in some way, shape, or form happens to you, which HIV may have affected either your life or someone you know's life or vice versa. Is when you start noticing why we do it every year. To remember for the people that we've lost, for the work that we're doing. And this is actually why I started working in this field actually 5 years ago. And also as well, because there's still a lot of stigma, there's still a lot of education that's still not there. There's still a lot of misinformation. There's a lot going on still in the world of HIV. That this is why we have to bring this awareness day to everybody, to get people up to date, to show them that, hey, this is not like it was back in the 80s or the 90s, that things have changed so much. And that, and I don't know if for some people my age, the same experience was for them, where it wasn't really much of a thing, I guess, for them, because it didn't apply to them until something in their life has happened to them, or they knew somebody that was affected by it in some way, shape, or form. So yeah, it's just I guess a little bit different on my end. It's not something that kind of like with what's going on in the world right now, where you kind of you lead on, not that you lead onto it, but you see it now growing up. You kind of get the full story from the beginning. It's more of like a catch up for us in generation. But once you do catch up, which is what happened to me, you start noticing how much change has happened ever since. And it's kind of like what Robert Goubeaux says, we have light at the end of the tunnel. We really do. I know that's something that we're going to be talking about, I think. I'll bring it up, or we'll bring it up about it. And it's very good news, I think.
Right. I am glad that we actually have that range, that contrast of someone who actually was there at the beginning, and now someone who was born the same year that the day of observance was created, and we both can actually see the progress. And that is going to lead us to today with our next topic on the state of HIV today.
Today, we have so much more than we did back in the days. And I love the difference here between Jairo and me. And we can really show what the difference is between the generations. Because, I'm old, I guess. So
take you as you are.
Right? Experienced, I guess.
Yeah, seasoned.
So, back in the day, we had nothing. We just watched people die in front of our faces. we formed groups to take care of people because no one wanted to take care of anyone with HIV or AIDS in those days. It was a very sad time, a very hard time. And as we've progressed, we've seen the great strides that we have made. Now that we have, it used to be a death sentence. You went and got your results and you sold everything and gave everything up and just prepared to die. But we know now that, we have such great drugs out there, medications that we can give. It's not a death sentence anymore. It's, living with the HIV. And as we're going to talk about, I think in the next coming up is, prevention and ending this epidemic. The medicines before were so horrible, the side effects. I can remember, we used to have to take 15 medications a day, twice a day, and with food, and you had to keep some refrigerated and some not, and the side effects of the just horrible side effects. So we've really seen a great progression in the medications. Obviously, coming out in the future are injections and things like that. But we'll go ahead and talk about those, I guess, as we go further. If there's anything else I can add, or Jairo,
if absolutely. Because today, I believe since 2003, the rapid test, for instance, is something that came into effect, because prior to the rapid test, it would actually be nice to know what kind of tests were available prior to the 2000s, and how long were people waiting? Because we know today you can take a 1 minute, a 20-minute, you have the fourth generation, but I don't believe that was the case in the 80s.
Yeah, definitely. And before I kind of delve into a little bit into that, I kind of want to add into what Dr. Goubeaux had talked about, and also to continue that contrast as well, because for just like how we mentioned, where if you have people around the 80s and 90s who were diagnosed back in the day, it was a death sentence essentially. So there was a whole emotional, I don't even know how to describe it. Back then, if you had that got diagnosed then, and we didn't have the knowledge that we know today, we didn't have the medications that we have today, and also the side effects that came with them if you took the medications. It was emotionally tough for those people. I remember, during the course of being in this field, I had some people, so some older folks that explained their story, and it was very emotional, very touching, because they noticed how much we've changed, and that they almost lost their lives if technology or innovation didn't really evolve as fast as it did now. And then I contrast it with people who, let's say, get diagnosed today. I honestly get surprised sometimes how well some people take it, and I'll always remember this instance of a young person. I remember testing them, came out reactive, and their reaction was, okay, what's the next step? Like, don't get me wrong, I'm pretty sure it did take a small emotional toll, but the person was straight to the point. What's next? What should I do? Like, I don't know. It's just the contrast now. The information is out there. People. I'm seeing that our work is paying off when it comes to education, when it comes to that awareness, and also as well as and now going back to the whole testing part. Which, back in the day, you had to wait. You had to do a blood test. There was no rapid test back then, obviously. That was a blood test, which might have taken a few weeks to get back, and just having that suspense that whole time, it's not good for you. But then nowadays, we have different type of rapid tests. You have the ones that you'll find out in minutes. You'll find it the same day. You can do them at home now with the oral swab, which I gotta let everybody know that the home testing kit is available to do so if people want to do that. But all that's available that we didn't have before, so people can know their status sooner. And then the sooner that the people know, the sooner they, God forbid, if it does come back reactive or positive, they can go to treatment. They go to the doctor, get treated as soon as possible, which that has also changed too. Again, we talked about the medications, how that has changed. It used to be 15 pills a day or a high amount with side effects. Nowadays, only 1 pill a day, the size of a multivitamin, barely any side effects. And there's different types or classes of HIV medications for people who, let's say, may have different side effects or different effects or whatever the case is. So there's a lot of customization there, a lot of variability there. And then what also has changed as well is how fast somebody goes from, let's say, getting their diagnosis to when they can see a doctor / get their medications. It used to be back then, and this is maybe a few years ago, where if the test were to come out reactive, you'd have to do a confirmatory test, which is a blood test to confirm your rapid test, which again takes about a week or two. And then from there, schedule to see a doctor, which that can take some time depending on the availability or the schedulability of the doctor and the office. And it's a whole amalgamation of obstacles that can happen, which during that time, a client can lose morale and just not show up. So in order to prevent that, that's what the test and treat program was created a few years ago, where basically if someone were to test reactive with a rapid test at the office, that same day or next day, depending on how late the day ends, they essentially sign up, see a doctor, get the medications same day, if not next day, to prevent most, if not all, those obstacles for the client. And also as well, again, if they have any concerns or anything like that, they can speak with the doctor then and there, just in case they really want more, direct information from somebody who really knows the field much better than, let's say, I do.
All right. We have made a lot of strides and made a lot of progress, but something happened last year, COVID-19, and although we have made a lot of progress, there are a lot of potential issues or challenges that COVID has presented. Are there any things in particular that the both of you could bring up that COVID has probably slowed the delay of, or do you think that we can easily overcome this new hurdle?
Oh, yeah. You want to begin, Doctor, or you want me to begin?
Go ahead, because I know you have a lot on this, and I can put my 2 cents in there too.
Yeah.
But as you were even saying before, the test and treat program, and we started that here even before the Department of Health even started that program. We had put it in and started it really moving before we even got with the Department of Health. So that's been a game changer, a major game changer. As you said before, you had to wait weeks and then patients would just disappear. There weren't people treating HIV. You had to go to a specialist or a certain place to get treatments. Most private doctors didn't want anything to do with it or didn't know how or didn't have the knowledge. So I'll let you pick up from there and then we'll go ahead and kick back and forth.
No, yeah, definitely. No, you're right. Actually, not many doctors knew about it, which is unfortunate because, HIV still affects us all today. It's important to at least have basic knowledge surrounding it. But going back to COVID, so yeah, no one has been spared from that. And I'm pretty sure, and I say that in a way of that, in regards to my side of things, testing for HIV testing, that's affected basically everything there as well, because we, obviously, you have a waiting room and obviously with COVID, you can't necessarily have, a large amount of people waiting or anything like that, especially, and I'm pretty sure in the medical department as well, there's a waiting room. There's a limit of people where they can be, that can be huddled up in there. We can't do that during COVID because, as we know, COVID spreads, pretty easily in crowded rooms like that when there's not much circulation or anything like that. So it definitely has affected how people get tested. They're not as willing or forthcoming to come into an office because, again, there's that fear, and especially now, which we're in December. there's there's a quote unquote third wave going on right now, which is worse than the past two. And right now it's even more important now to stay home, be safe, social distance, wear your mask, all the 9 yards, essentially, to make sure that you're doing your part to prevent the spread of COVID. But again, it goes, it also hurts people who, let's say, want to get tested, but also don't want to get COVID at the same time. It's hard for them because they're in the middle of that. Okay, if I don't go get tested, I won't know my status, but I stay safe from COVID. But if I do go out and get tested, I'll know my status, but now I have a risk of getting COVID. So this is where innovation and kind of thinking outside the box comes in, and that's why I had mentioned about the home testing, and that's why we had developed it in response to it, where basically they can clients can go online at careresource.org/home testing. They go there, fill out a form, submit it, and then basically a counselor will call them up and then do essentially the session over the phone. And then from there, the client can either have the counselor deliver the home test kit to them at their residence, or they can come to the office themselves if they're not too far away, to actually pick up the test kit, from in their car. They don't have to go into the office or anything like that. We go to them downstairs and just give them the home test that way. So, we have a few different options. I think also we have a shipping option that's only for people who are pretty far away within Miami-Dade and Broward counties, but most people choose typically the first option, which is that the counselor goes to them and drops them off. It's most convenient for them. But, little things like that, to try to still give access to clients while this whole pandemic is going on at the moment is important. I don't know if you're going to add. Uh-huh.
Yeah, I would say I think that's one of the most important things is with somebody who's working in this or a community center, I think, is to have that really strong relationship between you, the outreach, the case management, to have those really close connections, because once that person either tests positive or something, there are many options now of trying to get them in. And we always get them in the same day. We get them on medications. And then now with the telehealth, we have that option of course, we want to see them that first time to do the assessment, talk to them, check them out, do the physical exam part. But then there are the follow-ups that can be done easily through the telehealth portion. And that has helped quite a bit. So it's really important to have those connections. It's just not one part of the medical system that has to work together for this. We all have to be really, really synced together to make this work in this time. It's a lot more difficult.
It is, but we're getting through this.
But we're doing it.
Mm-hmm. Oh, absolutely. Absolutely. COVID has nothing on us. Okay.
Exactly.
So our last discussion will be on the strategy to end AIDS, a global fight with U equals U. We're aware that there are several things that can prevent HIV, such as using condoms, getting tested regularly, pre-exposure prophylaxis, post-exposure prophylaxis. But a huge aspect of not only ending the epidemic, but keeping those living with HIV healthy is treatment. Treatment as prevention. U equals U. I would love to hear what you all would like to share about U equals U and how that is essential in the strategy to ending AIDS.
Sure. So, it's so exciting. I mean, it really is. I get excited when I talk about it or hear about it. We do now that, undetectable, unable to transmit. Okay. We know that now. So that's a great strategy for us. The second thing is, it used to be the 90-90-90 kind of theory, where you got 90% of the population in to get tested, and then of that 90, you got treated, and of that 90, you got undetectable. So, now it's just, there's so many tools in the toolbox now. Getting those in, like we say, test and treat, getting them in, getting them right onto medication. Most of the time they're undetectable within a month. Reaching out to those that are at risk, getting them on PrEP, getting them protected so that we can stop, these further transmissions is so important. And, not only in the gay community, the LGBTQ community, but in every community, we need to really have that outreach, and that outreach as in total health, so that people aren't stigmatized saying going to a testing site for HIV, oh no, I don't want to go there. Having fairs that are total health, and incorporating that in and making HIV a normalcy kind of testing. Just like you get your blood pressure tested, your sugar, your cholesterol. It's a normal routine. Trying to get that, I think, is what's really important into ending, getting this ending done. And the new PrEP things that are coming out, not just the pills now, the injections, the patches, it's just incredible what's coming out in the future.
Yeah, to add on it, I actually want to give, the viewers kind of a vantage point of all the things that you, Dr. Goubeaux, and Kishi have mentioned, the PrEP, post-exposure, condoms, patches, the upcoming stuff as well. How much that has affected, in a good way, the landscape of infections, or how they lowered and whatnot. So just to give the viewers kind of a perspective, back when HIV came out, obviously, rates were rising. I think, and since we're in a new decade, I'm kind of going to use the last decade as an example. So I think, if I remember correctly, I think it was around 2008, 2010. We'll use 2008 just because that was about 10 years ago, 10, 12 years ago. In the United States, we used to have about a maximum, or a little higher than that, 50,000 or so new HIV cases yearly in the United States around that time last decade, 2008, 2010, more or less. And then if you go to the I think the CDC website or the AIDS.gov website, and if you look at the 2018 statistics, which just came out a few months ago for 2018, the rates in the United States for new infections every year, or at least as of 2018, shows at 38,000. So it went down about 12,000. Again, slowly over time. Obviously, it's not going to be all of a sudden so quickly. It doesn't happen that way. But it's telling us that all those tools that we just mentioned in our toolbox are working. You're undetectable equals untransmittable. That's working. Again, if the person's undetectable, has an undetectable viral load, that person just simply can't transmit. Plus, as well, they remain healthy as long as they're on the medications, no problem at all. If they're on PrEP, again, there's Truvada, there's Descovy. Descovy is a new medication that replaces essentially Truvada. Much smaller, less side effects. That we know also helps. Obviously, we all know what condoms are. I'm pretty sure we're not going to go into detail with that, but I'm pretty sure everybody knows what condoms are. That helps. And then, as well, general education, getting tested as well, every 3 months, every 6 months. That even just getting tested, it's a sort of form of prevention, because, the more often you test, God forbid, again, if you get a diagnosis, you'll know sooner than later, and you prevent the spread to other people. And then again, when it comes to emerging technologies, I know right now I think there's studies going on for injectable PrEP for people who don't like taking pills and want to go to the doctors every so few weeks or months. That's a great option. And it just goes to show how, again, technology innovation, is showing, and we're seeing it as a decline in overall rates in the United States. So it's great that from a decade ago we are actually lower than higher, actually. So it's actually very good, but as we know, we still have a lot of work to do. We have to keep this fight going. Again, this is the purpose of why we have World AIDS Day. As a reminder, as awareness that, hey, World AIDS Day is a day of remembrance, but remember, the fight is still not done until, we literally end the epidemic.
Yes. Perfect. Let me tell you, and you know, and PEP, post exposure, you know, that has come such a long way now too. And for anybody out there, you know, that happens to have an exposure, you know, getting in within 72 hours, getting on that medication can prevent that transmission. So, you know, just we've got so much to look forward to. It's so exciting. I'm just excited about the future.
No, and speaking of which, the post-exposure, I'm actually kind of glad that little by little, like emergency rooms, urgent cares are learning more about it, because that used to be a problem as well back in the day. And they're being more aware of it in the event of, let's say, you know, if, you know, your 9 to 5 clinics are closed and you have to go somewhere, you know, it's much better now that, you know, the urgent cares are more aware of it now. Because I think I know we had the conversation before, but yeah, they didn't really know that they actually call us at some point, which thankfully that has changed over time, but still needs to be worked on. That's, again, going back to the whole thing of why World AIDS Day is so important.
Yes. And just to let everybody out there know too, you know, if you don't have insurance, if you don't have, you know, money, accessibility, come see us. Come see anyone, any of the community health centers. We can help. There are ways. We have many magic ways we can try to find and get you treated. So don't ever think that you are, just because you don't have insurance or you don't have money, you're homeless, somewhere out there, you're not lost. Come to us. We can help you.
Well, thank the both of you so much for joining. I am glad that I got to have this conversation with you. You've given the viewers a lot of information. And as a reminder, I'd love to let the viewers know that Care Resource is still open Monday to Friday, 8:30 to 5. We do have health promotion providing complimentary HIV and STI testing, as well as at-home HIV testing that can be delivered once you go to careresource.org/home testing. We can deliver a testing kit to your household. Also, if you do not have primary care, or you would like to, or you would also like to receive a COVID test, the medical department can provide that. So we're here for you. Happy World AIDS Day. Thank you all so much for watching. This is The Health Connection, and we will see you next time.
Don't forget to like us on Facebook at facebook.com/careresource, or follow us on Twitter at careresourcefl, or subscribe at youtube.com/careresource. For more information or to find a location near you, visit us online at careresource.org.